Okay, so one of the questions I get from almost all my patients is, what's the best way to sleep? And now, whether we're talking about the bed, the pillow, or the position you're sleeping at night, people really just want to know what's the best for their spine. Now, to be honest, there's not a one size fits all answer. Everybody's built differently, and we all have different preferences, but there are a few simple guidelines that work for most people. First, let's talk about position. Sleeping on your back or your side is usually the best for your spine. Stomach sleeping, on the other hand, puts a lot of stress on your neck and your lower back, and it's not typically recommended. Now, secondly, we'll talk about the pillow. A good pillow should keep your head level with your spine, not push too high where your chin like comes forward and touches your chest, and not too low where you're sinking backwards. Now, if you're a side sleeper, you'll want typically a pillow that's a little bit thicker to keep your head up here. And if you're a back sleeper, you actually want something a little bit thinner so your head's not being pushed forward. Third, we'll talk about the mattress. You don't necessarily need the fanciest or most expensive bed. What you really need is something that supports your spine without letting you sink too much. Honestly, I tell most of my patients to look for a medium to firm mattress. Think supportive, but still comfortable. And honestly, if you're really waking up with stiffness or pain, it's typically not your mattress or pillow that's the issue. It's really how your spine is functioning. And that's where chiropractic care comes in. At Antignolo Chiropractic, we help people not only sleep better, but we also help them wake up feeling much better too.